5 medical checkups I'd never get after 70. Modern medicine is incredible, but as we cross the 7th decade of life, the risk-to-reward ratio of certain screenings shifts dramatically. We have to move away from overdiagnosing and move toward quality of life. Many tests are designed to find slow-moving issues that would never actually affect you in your lifetime, yet finding them leads to invasive treatments. We want to focus on the biological signals that matter for your immediate vitality and long-term strength. This is about being smart, being proactive, and being fiercely protective of your well-being. The first checkup to reconsider is aggressive cholesterol screening for the sake of hit-list numbers. While heart health is vital, the way we look at these numbers changes as we age. In your 70s and 80s, some research suggests that having slightly higher levels might actually be protective for brain health and cellular repair. If you are feeling great and your vascular health is stable, obsessing over a specific decimal point can lead to unnecessary interventions that might sap your muscle strength and energy. We want your blood flowing perfectly, but we don't want to over-medicate a healthy system. Focus instead on how your body feels and your overall circulation. Your body is a complex ecosystem, and after 70, it has developed its own unique balance. When we try to force that balance to match the charts of a 30-year-old, we often cause more friction than flow. The goal is to support your natural systems, ensuring your vessels are flexible and your heart is strong through movement and nutrition. This approach keeps you in the driver's seat of your health without the anxiety of chasing perfect numbers that don't reflect your actual lived experience. Next on the list is the routine aggressive colonoscopy for those over 75. While early detection is key in middle age, the procedure itself becomes significantly more taxing on the body as the years pass. The prep alone can cause dehydration and electrolyte imbalances that take a senior's body a long time to recover from. Furthermore, the slow-growing nature of many issues means that the screening may find things that would never have caused a problem. If you have no symptoms and no high-risk history, the physical toll of the test might outweigh the potential benefits. We must weigh the stress of the procedure against the actual likelihood of it changing your life for the better. There are now non-invasive ways to monitor your digestive health that don't require the intense stress of a traditional hospital procedure. This is about choosing the path of least resistance for your body while still being vigilant. Always listen to your internal signals. If your digestion is smooth and your energy is high, that is often a better indicator of health than a traumatic day in a clinic. Your comfort and recovery time are precious commodities at this stage. The third screening to watch out for is routine PSA testing for men over a certain age. This is a classic example of finding something that often doesn't need to be fixed. Most men will have some changes in this area if they live long enough, but these changes are usually so slow-moving that they would never impact their life expectancy. However, the discovery of a high number often leads to biopsies and treatments that can have significant side effects on your daily comfort and function. It's about choosing to avoid the cascade of intervention that starts with one simple test. Instead of looking at a single number, we look at the whole man. Are you active? Are you sleeping well? Is your body functioning as it should? When we focus on vitality rather than just searching for microscopic changes, we tend to stay healthier and happier. If there are no symptoms, sometimes the best medicine is to keep living a high-vibe, active lifestyle and skip the stress of the search. This doesn't mean ignoring your health. It means being highly selective about which battles you choose to fight, ensuring you always have the energy for the things you love. Fourth, we need to talk about routine DEXA scans for bone density when there is no history of fractures or significant risk factors. While bone health is paramount, a scan alone doesn't tell the whole story of your strength. You can have thin bones on a scan, but have incredible bone quality and muscle support that keeps you safe. Over-focusing on the scan results can lead to a fear of movement, which is the exact opposite of what you need. Movement is what keeps your bones strong. If you are walking, lifting, and staying active, you are already doing the best work possible. The fear generated by a low score on a bone scan often causes seniors to stop being active, which actually accelerates the weakening of the frame. It is a total paradox. Your focus should always be on balance and functional strength, the things that actually prevent the falls in the first place. A strong muscle is the best protector for any bone. By focusing on your stability and your ability to move through space with confidence, you are doing more for your skeletal health than any diagnostic image ever could. Trust the strength you feel in your legs more than a printout. Finally, we should be cautious with routine asymptomatic EKGs. Your heart is an amazing, adaptive muscle that might have developed its own unique rhythm over 7 decades. Finding a slight abnormality on a screen when you feel perfectly fine can lead to a rabbit hole of more tests, heart catheterizations, and stress. If you can walk up a flight of stairs without getting winded and your heart feels steady during your daily activities, you are likely in a great place. The stress of the finding can often do more damage to your heart health than the finding itself. We want to protect the heart by keeping it active and fueled with the right nutrients, not by constantly poking at it with electronics when it is doing its job well. This is the philosophy of watchful vitality. We stay aware, we stay healthy, but we stop looking for trouble where there is none. This allows you to live with a sense of freedom and lightness. You aren't a patient waiting for a diagnosis. You are a vibrant individual living a full life. That shift in mindset is one of the most powerful medicines available to you. The secret metric I mentioned earlier, the one you should track instead of these tests, is your recovery rate. This is how quickly your breath and heart rate return to normal after a brisk walk or a bit of exertion. This is a direct window into your autonomic nervous system and your cellular health. If you can recover quickly, your body is resilient. It means your mitochondria are working, your blood vessels are elastic, and your system is in sync. This simple daily observation is free, requires no needles, and gives you an instant report on your true biological age. Focusing on your recovery and your daily energy levels puts the power back in your hands. It encourages you to stay active, to eat the foods that fuel your cells, and to enjoy your life without the constant shadow of medical overreach. You are the world's leading expert on your own body. When you learn to listen to its signals, the way you feel when you wake up, the strength in your stride, and the clarity of your mind, you will find that you need fewer tests and more adventures. That is the ultimate goal of senior health. Aging with power means making informed choices that prioritize your happiness and your ability to move freely. It's about questioning the status quo and demanding a healthcare approach that respects your wisdom and your unique biology. You've worked hard to reach this stage of life, and you deserve to enjoy it without being bogged down by unnecessary medical bureaucracy. Take a deep breath, trust your intuition, and focus on the habits that make you feel alive today. Your health is a journey of joy, not a series of checkboxes. By choosing to focus on functional health over arbitrary screenings, you are joining a movement of seniors who are reclaiming their autonomy. You are proving that the later years can be the most vibrant and fulfilling of all. Keep your body moving, keep your mind sharp, and keep your spirit high. Every day is an opportunity to strengthen your foundation and celebrate the incredible machine that is your body. You have everything you need to thrive right now. Thank you for being part of this health revolution and for taking your well-being into your own hands. If you want to keep discovering the real secrets to longevity and how to navigate the medical world with confidence and ease, make sure you subscribe and join our community. We are here to support each other in living long, strong, and completely on our own terms. I will see you in the next video where we continue to unlock your highest potential for health and vitality.